My name is Dr. Monika Friedrich. I'm a podiatrist, and I take care of any foot and ankle problems. I went to Scholl College. It's a podiatry school. It's part of Rosalind Franklin University, and I did my residency at Loyola University Medical Center, and as part of that residency, we also rotate through the Edward Hines VA, so we have a lot more experience treating all different kinds of patients. I've always known I wanted to be a doctor ever since I was little. My cousin has muscular dystrophy. I could never understand why he couldn't walk better or get better, so that it really put a spark in me to be a doctor. When I started college, I learned about podiatry. The more I looked into it, the more I liked it. As a podiatrist, I treat any condition of the foot and ankle, so whether it be skin conditions, rashes, warts, nail problems, ingrown toenails, fungal toenails, go all through the sports injuries such as fractures, sprains of the foot and ankle. We take care of wound care, patients who've had wounds for a long time, or diabetic patients who develop wounds. We do a lot of preventative care for patients who are diabetics, who are higher risk. I'm really interested in doing sports medicine, so treating sports injuries. I really like getting patients back on their feet and getting them back into the activities that they love doing. I also love doing surgery. You get if the patient does well after their surgery, they're always so very happy, and I also enjoy treating diabetic patients and geriatric patients. Also, they always struggle with having foot pain, and I'm able to get them back to walking more comfortably very quickly. Medicine is advancing fairly quickly as the technology is advancing, so there's always something new. Whenever I go to conferences, there's always new surgical technique, there's always new implants or screws. The newest thing is doing laser treatment on nails, so there's a lot of hype around different things. I like trying out new things, but also I like to do things that are time-tested and researched thoroughly. I really like treating patients like I would like to be treated at the doctors, or how I would like my family to be treated. So I know I hate being rushed at the doctors and think they need to come in and out because they have another patient. So I always make sure that the patients have adequate enough time to explain all their problems, what's going on, and that they don't feel rushed. To make sure that we take the time to have a full exam so we don't miss anything. I also like to have patients participate in the decision making on the treatments. So especially when I see the patient for the first time, I'll go over what's going on with what kind of problem they're having, and kind of the treatment options, because not every treatment is perfect for everyone. So I feel like patients really respond better to that, and when they're able to participate and decide on their treatment options, and they get better quicker. What makes our practice unique, we have a wonderful staff that we always want to make sure that the patient feels comfortable in our office. We also have a multilingual practice, so we have staff that not only, obviously they're fluent in English, but also Spanish and Polish. I'm actually fluent in Polish myself, so I find that it really makes a difference for patients. Even though they know English, it makes a difference when they're able to express themselves and describe their problems in their native language. The thing that I find most rewarding is getting patients better and having them be able to walk out of clinic pain-free.